here we go. Scapular stabilization, level 3. You're doing well. Keep at it. Keep on the good work. Today what we're going to see is shoulder shower routine. I call it like this because it's easier to remember. It doesn't have to be done in the shower, but it's just an easy way to remember. There's 3 exercises in there. The quadruped T-spine rotation. Scapular YTWs, you're already familiar with those, but all you need to do at this stage is increase the resistance. I'll give you tips on how to do that. Scapular ball stabilization, you don't need a ball, any sort of ball will do. And finish up with shoulder extension with overpressure. So we're adding shoulder movement also and thoracic spine movement, because the reason why you started scapular stabilization is either you have a shoulder condition or a thoracic spine condition. So you need to mobilize the limb, the shoulder, and you also need to start mobilizing the thoracic spine because they all link. And if you don't, your condition won't get to 100% better, right? So let's get started with the shower routine. So you should do those 3 to 5 days a week. Level 3 and 4 are more advanced level. They're more of a maintenance level, so 3 days a week is good. 5 days a week is even better. And it's a 3 to 4 week program, and you progress same thing than the other. If you can do those 5 exercises as prescribed, so up to 10 repetitions each, without any pain or discomfort, you'll be ready for the next level. Some of these exercises may seem easy. It's important that you continue with those because they're crucial for the next step. So the next step, level 4, are going to advance those exercises, so the degree of difficulty is going to increase. And if you skip them in this level, you're going to may find them difficult on level 4. So keep doing them, even if they seem easy, for 3 to 4 weeks, and the next level will bring it up a notch. Alright, so shower routine, first one. So I call it my shower routine because you can use the shower in the morning, put some heat on the affected shoulder, or if you don't want to do it in the shower, you can always put a hot pad on the shower before you start those exercises. So you let the water run, you're going to grab the head of the shower, let me open the door fully, and you're going to lean forward, good, until you feel the stretch. This is stretching the posterior capsule of your shoulder. You hold that position 5 to 10 seconds, and you do 5 repetitions. Lean forward, 5 to 10 seconds, 5 repetitions. Should do it on both sides. It's important to do both sides to compare. Yeah, you want to strengthen the muscle on both sides equally, but you also want to compare how well you're doing with your affected shoulder. So next thing, you're going to need a towel. So you get out of your shower, you grab your towel. Good. Keep your head straight. Good. The towel is against the base of my neck, and I'm using my left hand to raise my right hand, so my right shoulder. So I'm grabbing the towel like this. I'm going to move forward. Hold 5 to 10 seconds. It's a stretch, don't forget. And you do 5 repetitions. And you try to bring it as far as you can, right? So it should be uncomfortable but not painful. 5 to 10 seconds and 5 repetitions. Then you move on to the next side. So I'm going to put my right shoulder up and the left one back up. I'll show you here. I'm using my right hand to bring the left shoulder up. Five repetition, you hold that position 5 to 10 seconds. Then when you finish up, you're all dressed up, hopefully. Good. After you shower, use the door, both arms at 90 degrees, and you bend forward, lean forward gently until you feel the stretch. This is a pectoral stretch. You should feel stretch on your shoulder, but also the pec area. Hold that position 5 to 10 seconds, 5 repetition. Good, so once you've done that, you're ready for quad thoracic spine extension. On all four, you bring one arm at the lumbar spine to lock the lumbar spine, and you're gonna rotate up like this, hold 1, 2, and relax. Look up to the sky, hold 1, 2, and 10 repetition. Same thing on the other side. My hand behind here, see, the lumbar spine. Hold 1, 2, 10 repetition. And repetition on each side. Next one is YTWs. So if you have a turban, you're going to use them, right? Wrap around the door handle. Make sure your door is closed properly. Always. So the band doesn't snap back at you. And it's your YTWs. So Y, bring both scapula together. Hold 1, 2. 1, 2, the T, and the W, 10 repetitions. So how to increase the resistance? You should have difficulty doing the last 2 repetitions of each exercise. So last 2 Ys, last 2 Ts, and last 2 W should be a little bit difficult to achieve. So that's how you gauge your resistance. There's different color TheraBand that you can buy at sports stores, Shoppers, Drug Mart, and so on. Or you can use water bottles. So you start with small water bottles, half full, fully full, and then you go a bigger water bottle, half full, fully full, Pepsi bottle, and any type of bottle you can find that gets bigger and bigger. There's going to be a limit. Don't do 50-pound weights. If you have dumbbell, you can use dumbbell. Start with 1 to 5 pounds. Small dumbbells, not 10, 15 pounds. It'll be too much to start with. And if you do it against gravity, so if you do it with dumbbells or water, I recommend you do it laying on your stomach against gravity. Just like such. So you do the Y, T, and the W, 10 repetition. That's simple, so you don't need to buy any equipment. I'm sure you can find water bottle around, right? So next one is scapular ball stabilization. Any type of ball would do. Something little bouncy. Dollar store, Dollarama, Giant Tiger. They always sell small balls, so you can find one. A soccer ball, basketball, and so on. And with your shoulders straight, you just do circle against the wall. 10 repetition on one side, 10 repetition on the other side. I'm going to do it here. 10 repetition, 10 repetition. Both arms. 10, and you can do this at different angles, so 90 degrees, up, facing the ball, 10 repetitions. So once you've done 10 repetitions on each side, you're going to do pass, right? Repetition, can do the same thing on one arm. And it's a push motion, you want to push it, right? 10 repetition. Alright? This is an easy exercise, but it's a good precursor for what's about to come next level, which is going to be weight bearing, so standing on one arm, weight bearing scapular stabilization. So that's very important that you don't skip that one, even if it may seem easy. And the final one, you'll need a broomstick for that. Shoulder extension with overpressure. Bring it out as far as possible, and then you're going to push with the opposite arm. So this is stretch the anterior capsule of your shoulder. Hold 1, 2, and relax. Hold 1, 2, and relax, and always both sides. 1, 2, 10 repetition. So here we go. So those 5 exercises, the shower routine, the T-spine rotation and quadruped position, your YTWs, the ball stabilization, the scapular ball stabilization, and your shoulder extension with overpressure. Minimum 3 times a week. We are at maintenance level now, so you can do those, you can get away with doing them only 3 times a week. If you want better result, keep at 5 days a week. Most of them are 10 repetition, and once you can do the series without discomfort or pain, you'll be ready for a level 4. So level 4 is definitely a maintenance program, and the level of difficulty increased a tiny bit, but not so much. So it's important that you keep with those exercises, because it's going to prepare you for the next level. So we'll talk to you soon, and have a fun time.